But so any questions before we break?
I have a question for you.
Okay, go ahead.
No, there's a question. Okay, so you probably knew this one's coming, but I have a question for both of you. How are you or have you included patients and caregivers in your work? It's very statistical. Do you see a role for patients, and what would be the obstacle?
I'm not sure if I understand the question fully. We do have a caregiver, care recipient modules in the CLSA, but it is basically quantifying the caregiver experience. If you're asking if we are conducting any qualitative work, is that part of the?
No, I'm wondering if you have any patients or caregivers advising you on
Yes,
your team about how the research should be conducted and helping you with dissemination.
Sure. We have done several things. Before we began the study, we actually did a public consultation across the country. And we wanted to understand what it means to people who are going to be the participants in the CLSA and what are the types of things that they look at. And since then, we have engaged with our participants, and we do a regular survey outside the collection of the data to see what are the areas of interest to them that are not reflected in the CLSA or their CLSA experience. And more recently, we have started to think about actually establishing a mechanism to do a citizen engagement, which is not based on few people sitting in the committee, but more as a citizen dialogue, how we can sort of generate interest. Now, it is easy to do in the sense, it's easy to say we want to do, but finding resources to do that in the context of this particular initiative becomes very challenging. So we've been looking at partnerships where we can explore those options. Does that answer your question?
Yes, it does.
Okay.
I have a question for Anik. Thanks very much for your presentation. My name's Rick Sawatsky, and it's very important work, this kind of baseline, very comprehensive. Really enjoyed your presentation on that. But I was struck by the representation of patients and family caregiver perspective or caregiver perspectives in the quality indicator literature. It didn't seem that surfaced a whole lot. I didn't see a lot of, I think quality of life was mentioned briefly in one of them, but it didn't seem to come up much, like the patient's perspective or the citizen perspective of their care and of how they are doing. And I wonder if you could comment on that.
So I just want to make sure I understand your question. So you're asking why, if we incorporated the perspective of patients and caregiver when we did the exercise, or do you wonder if this is an indicator? So can you just...
No, I'm just, it is my understanding that from your review, that most of the indicators were actually not directly reflecting the patient experience. The indicators that you showed.
Okay, the review is... So the literature, what's published, right?
Yes, exactly.
So we didn't extract information on how the studies were conducted. So when they conducted the study, so the primary studies, if they had incorporated patient perspective, so we don't know that. So.
Okay, so do you think that would be an important quality indicator?
It's a super interesting question. So we could have done that. So.
Yeah.
Especially maybe the studies who measured the impact of intervention, so whether they had or not incorporated patients in their study as participant or as co-I or as knowledge users.
Yeah. I guess I was referring to also questions about patient-reported outcomes and experience measures, and in a sense is a really good match with the Canadian longitudinal study of aging. But even in the CLSCA, I noticed there were some general health questions, and then there's all kinds of questions about certain perspectives, but I didn't see a measure of a patient-reported outcome or something like that. I was wondering if that's been on the table at all, considering that, there's a lot of interest in this in Canada. We're having a pan-national PROMS initiative that's being spearheaded by Kai-Hai, and I think there might be some intersection there.
Just to, the measurements that I showed is just a flavor.
Yes,
if you have a
Yeah.
chance, go to the CLSA website.
I did, yeah.
And it is complex. There are multiple modules spread all over the place.
Yes, I did.
And there are some, for example, what it means, what is healthy aging.
Yes,
Right?
yeah.
And we have a huge
Yes.
couple of open-ended modules that sort of collect information.
Yeah.
And there are several others spread through the whole data collection exercise in relation to the participant's point of view, what it
Yes.
means. And we are continuing to add whenever some of the things that new and emerging things come. One of the things we have been discussing is from the social support perspective, the quality of the social support, how that works. Because, and in fact, we wanted to add that at the baseline. In fact, we couldn't because some of the REBs actually thought it was too intrusive to be asking. And I can see why that was, because when we do collect data, the biggest challenge we run into the participant burden or the distress is when we ask the social network, social support questions. So we have to figure out what is the best way to ask those quality of your social support and social networks in a study like this, where you're sort of following lots of people that actually doesn't distress them. Yes, but there's quite a few there, and there's always an opportunity to add, and if you have suggestions, send it our ways, and we'll see if those can be added at some point in time in the future.
Hi there, Deborah Fels from Ryerson University. Given that there's about 10% of the population that has communication disabilities, I didn't really see how you were going to be able to include people who spoke sign language or who were non-speaking in your telephone surveys. Do you have a strategy for that?
Well, there's a couple of things, and I think one of the things one has to realize when you're doing study like this, large cohort like this, you are making certain compromises. And at the baseline, you can see people who are hearing impaired, who couldn't use the phone, would not be included in the study. So at baseline, some of those people were not included. So the sample does become slightly skewed in that sense. But as I mentioned, going forward, as it happens, we have developed multiple accommodations where if somebody can't answer the phone and cannot answer the questions by a phone, we have other strategies put in place that will collect data from them in different alternate ways. It might be a mail questionnaire we might do, or the people who have access to internet, we will be able to do web-based interviews because they might be able to do that, so on and so forth. So there are strategies for accommodations. I would probably need an hour here, and I'm more than happy to talk about, to describe what different permutations of accommodation strategies one will have to use in the study. We are very much aware of what you're raising, but at baseline, that was a decision made. Going forward, we'll accommodate these people as their hearing and vision impairments happen, or other impairments. There's all sorts of things that will happen in the context of this study. Yes, good question.
And maybe just to inform you for the scan, when we had put in the proposal, we didn't have in-person interview for patients, so we changed afterwards, and we had to recruit students in each of the provinces to, we decided to go with students, and they were the one who were able to do the in-person interviews. So it is a challenge. It is a challenge to have frail seniors as study participants.
And that's one of the reasons 30,000 of those people, they don't give anything by telephone. We go to their homes. We do a face-to-face interview, meet with them, and we're able to accommodate a lot more.
Well, that's that perfect timing, so that takes us up to our break. I'd like to thank our presenters again, and